contracting for safety has not been shown to be useful with patients who are psychotic, impulsive, depressed, or agitated. In fact, some evidence even suggests that it may be harmful for people, especially those diagnosed with borderline personality disorder. When we think about borderline personality disorder, these patients have really, at the core, a really hard time controlling the intensity of their emotions. And a lot of them have pretty low frustration tolerance and very poor impulse control, meaning that they're very apt to make rash kind of actions that can sometimes be very drastic. So what I imagine is when you're somebody with borderline personality disorder and you're in a position where you're starting to have these level of dysphoric feelings that reach the level of suicidal ideations, you kind of think back and you remember the promise that you essentially made your doctors. And I feel like that level of responsibility may even contribute to that feeling of dysphoria, that the feeling that they might let somebody down. And at the core of it, why do patients with borderline personality make impulsive and rash decisions that sometimes take the form of suicide attempts? It's because they're unable to tolerate that intense emotions of dysphoria, right? So that they act out in a way that's going to distract them from that core feeling. So it might be a case where that contracting for safety is adding to that level of commitment that they feel, and having these kind of negative emotions, there's an internal conflict there. And that's more likely to lead them to a place where they're going to act out in a drastic way so that they can take their mind off of the commitment that they made.